Between 6 a.m. and 10 a.m., more seniors die of heart attacks than at any other time of day, and there is one specific morning habit, something most people do within the first 25 seconds of waking up, that dramatically increases that risk. I am Dr. Elliot Grant, cardiac surgeon. In 25 years of surgery, I have seen this pattern destroy hearts over and over. This morning, after watching this video, you will never do this again. Let me start with a number that should stop you cold: 40%. That is the percentage of all heart attacks that occur between 6 a.m. and 10 a.m., not evenly spread throughout the day, not random, not concentrated in the afternoon or evening when you are active and stressed. 40% of them packed into just 4 hours every single morning. Think about that. Nearly half of all heart attacks happen while most of you are still drinking your coffee, reading the newspaper, or getting dressed. Stroke risk is also highest in these same 4 hours. The risk of an ischemic stroke, where a clot blocks blood flow to your brain, is 49% higher in the morning than at other times. Sudden cardiac death, where the heart just stops beating without warning, is 3 times more likely to happen between 6 a.m. and 10 a.m. than in the middle of the night. These are not guesses. These are not my opinions. These are numbers from the American Heart Association, from the Framingham Heart Study, from Harvard Medical School, from decades of research involving hundreds of thousands of patients. Something about the early morning hours puts your heart at maximum danger, and here is the part that most doctors never explain, that almost no one tells you during your annual physical. Your body is already under significant stress when you wake up. Your blood pressure naturally rises in the morning by 20 to 30 points. Your heart rate increases by 10 to 20 beats per minute. Your blood becomes thicker and stickier because you have not had any water for 6, 7, or 8 hours. Your stress hormones like cortisol and adrenaline surge to wake you up. All of that is normal. All of that is your body preparing for the day. That is not the problem. The problem is that for a senior over 60, especially one with even mild, undiagnosed heart disease, high blood pressure, diabetes, or stiff arteries, that natural morning stress can be the tipping point between a normal day and a fatal heart attack. And then you add one specific morning habit, something you do within the first 25 seconds of waking up, something that feels completely harmless, even healthy, something your parents did, something your grandparents did, something you have done every single morning for decades. That habit takes that already stressed morning heart and pushes it over the edge. I have seen it happen in my operating room. I have seen it happen in the emergency room at 6:30 in the morning. I have seen it happen in the cardiac intensive care unit. I have seen families destroyed because a loved one did something they thought was completely normal. Today, I am going to name that habit. I am going to explain exactly what happens to your heart between 6 a.m. and 10 a.m. I am going to give you forewarning signs that your morning routine is already hurting you. I am going to tell you a story about a patient named Eleanor who almost died because of this habit. And then I am going to give you a safe, simple 7-step morning routine that takes just 2 extra minutes and could save your life. So what is this dangerous morning habit that millions of seniors do within the first 25 seconds of waking up? Here it is. I am going to say it directly. You throw off your blankets, swing your legs out of bed, and stand up immediately. That is it. Standing up too quickly after waking up, you have been lying flat for 6, 7, sometimes 8 or 9 hours. Your blood has pooled in your lower body, in your legs and your abdomen. Your blood pressure is at its lowest point of the entire day. Your blood vessels are relaxed and dilated. Your heart rate is slow, maybe 50 or 60 beats per minute. Your nervous system is in sleep mode. Then, within seconds of opening your eyes, you sit up and stand up. Your body has to do something extraordinary in a very short amount of time. It has to push blood from your legs all the way up to your brain against gravity. It has to constrict your blood vessels to raise your blood pressure back to normal levels. It has to increase your heart rate to pump blood faster. That process normally takes 30 to 60 seconds. That is how long your body needs to safely transition from lying down to standing up. But when you stand up immediately within 3 to 5 seconds, you are asking your body to do in a fraction of the time what it needs a full minute to do safely. For a young, healthy person in their 20s or 30s, this is annoying at worst. You might feel a little dizzy for a moment. You might see stars. You might grab the wall. Then you recover. No harm done. But for a senior over 60, especially anyone with high blood pressure, diabetes, stiff arteries, peripheral artery disease, or any history of heart disease, that sudden standing can trigger a cascade of dangerous, potentially fatal events. Your blood pressure can drop sharply and suddenly, a condition called orthostatic hypotension. That drop means less blood reaches your brain. You feel lightheaded, your vision may go dark or blurry, your ears may ring, your knees may buckle, and if you fall, you break a hip, you crack your skull, or you cause a brain bleed. But the heart danger is even worse than the fall risk. To compensate for the blood pressure drop, your heart suddenly races. It can jump from 60 beats per minute to 120 beats per minute in just a few seconds. That racing heart, combined with the natural morning surge of stress hormones like adrenaline, can trigger an abnormal heart rhythm. That abnormal rhythm can degenerate into ventricular fibrillation, which is when the heart quivers instead of pumps. That is sudden death. I have seen it happen. A patient wakes up, stands up too fast, feels dizzy, grabs the nightstand, takes one step, and then collapses. By the time the ambulance arrives, their heart has stopped. All from standing up too quickly. Let me tell you about Eleanor. She was 67 years old, active, retired nurse, walked 3 miles a day. One morning she woke up, threw off her blankets, stood up immediately, and felt dizzy. She grabbed her dresser. She waited a moment. The dizziness passed. She went to the bathroom. She made coffee. She sat down to read the paper, and then she felt a crushing pressure in her chest. Her left arm went numb. She called 911. In the emergency room, we found that she had had a small heart attack. The cause? The sudden drop in blood pressure from standing up too fast caused her heart to race. That racing heart, combined with the morning surge of cortisol, cracked a small piece of plaque in her coronary artery. A clot formed. She survived because she called 911 immediately, but many people do not. Today I am going to show you how to prevent this. But first, let me explain exactly what is happening inside your body between 6 a.m. and 10 a.m. that makes this habit so deadly. Let me take you inside your body during those early morning hours. I will keep it simple, but you need to understand this. Your heart does not work the same at 6 a.m. as it does at 2 p.m. There are 4 specific things happening every single morning that put you at risk. I am going to explain each one clearly. The first thing is your blood pressure naturally rises sharply in the morning. Doctors call this the morning surge. When you sleep, your blood pressure drops by 10 to 20%. That is normal and healthy. Your heart rests, your blood vessels relax. About 2 hours before you wake up, your body starts releasing stress hormones like cortisol and adrenaline. These hormones are designed to wake you up. They also constrict your blood vessels and increase your heart rate. Your blood pressure can rise by 20 to 30 points within just 30 minutes of waking. For a senior with stiff arteries, which almost all seniors have to some degree, or with a partially blocked coronary artery, that rapid rise in blood pressure can crack a piece of plaque loose. Plaque is that fatty, calcified buildup inside your arteries. When it cracks, your body tries to heal it by forming a clot. That clot can block the artery completely. That is a heart attack. The second thing is your blood is thicker and stickier in the morning. You have not had anything to drink for hours. You have been breathing dry air all night. You have been sweating, even if you do not notice it, losing water through your skin and your breath. All of that dehydrates you slightly. Dehydrated blood is like thick syrup instead of thin water. Thick blood is much harder for your heart to pump. Your heart has to work significantly harder, and thick blood is more likely to form clots. A clot that forms in a narrowed artery can block it completely in seconds. That is another way to have a heart attack. That is also how most strokes happen. The third thing is your natural heart rate is slow when you are asleep. It might be 50 or 60 beats per minute. When you wake up and stand up, your heart rate needs to increase to 70 or 80 or even 90 beats per minute to pump enough blood up to your brain against gravity. That increase in heart rate happens because of your autonomic nervous system, which controls all the things you do not think about, like breathing and heartbeat. But in many seniors, especially those with diabetes, high blood pressure, or Parkinson's disease, that nervous system does not work as well as it used to. It is slow to respond. It is less reliable. So when you stand up too quickly, your heart rate does not increase fast enough, your blood pressure drops, you get dizzy, and your heart, struggling to keep up, can develop dangerous extra beats called premature ventricular contractions. One of those extra beats, if it lands at exactly the wrong moment during the heart's electrical cycle, can trigger ventricular fibrillation. That is when the heart stops pumping and just quivers without immediate CPR and a defibrillator. Death happens in minutes. The fourth thing, and this is the one most doctors miss, is that your body's natural blood thinners are at their lowest levels in the morning. Your body produces substances that prevent blood clots. These are natural anticoagulants. They follow a daily rhythm called a circadian rhythm. They peak in the afternoon and evening when you are active and more likely to get injured. They bottom out between 4 a.m. And 8 a.m. when you are sleeping and still, that means in the early morning hours you are naturally less protected against clots. You are more vulnerable. So let me put all four of these together. You have rising blood pressure, cracking plaque. You have thick, sticky, dehydrated blood that is ready to clot. You have a slow nervous system that cannot keep up with sudden standing, and you have low natural blood thinners that would normally protect you. That is a perfect storm. That is why 40% of heart attacks happen between 6 a.m. and 10 a.m. That is why stroke risk is nearly 50% higher in the morning. That is why sudden cardiac death is 3 times more likely. And when you add the dangerous habit of standing up immediately, within 3 to 5 seconds of waking, you are throwing gasoline on a fire. Your blood pressure crashes from standing, your heart races to compensate, jumping from 60 to 120 beats per minute. That racing heart meets the morning surge of stress hormones, your thick blood slams against cracked plaque, and your arteries, already vulnerable from decades of life, cannot handle the stress. That is how a healthy-looking senior collapses in their bedroom before they even make it to the bathroom. I have seen it. I have operated on the survivors. I have held the hands of the families who lost someone. I do not want to see it again, and you do not want to be the next statistic. Now let me give you for warning signs that your morning routine is already putting too much stress on your heart. These are signs that you are at higher risk. These are not normal aging. These are not things to ignore. If you experience any of these, you need to change how you wake up starting tomorrow morning, and you need to tell your doctor. Warning sign number 1, you feel dizzy or lightheaded when you stand up from bed, not once in a while, not just when you are sick or tired, regularly. Many seniors dismiss this as just getting older. Oh, I'm just a little dizzy in the morning. That is not normal aging. That is a condition called orthostatic hypotension. It means your blood pressure is dropping too much when you stand. A drop of more than 20 points is dangerous. Each time that happens, your heart has to race to catch up. Over time, that repeated stress weakens your heart muscle. It also damages your brain because your brain is not getting enough blood during those dizzy moments. And of course, it dramatically increases your risk of falls, broken bones, and head injuries. If you have to hold on to the wall, the bed frame, the nightstand, or your spouse to steady yourself in the morning, your body is warning you. Listen to it. Warning sign number 2, you feel your heart pounding, racing, fluttering, or skipping. Beats within the first few minutes of waking up. This is not normal morning energy. This is not excitement about the day. This is your heart struggling to adjust to the sudden change in position and the morning surge of stress hormones. Those extra beats, called palpitations, are often harmless on their own. Most people have some skipped beats. But when they happen every morning, or when they happen right after you stand up, they are a sign that your heart's electrical system is irritable. Irritable hearts are more likely to develop dangerous rhythms. If you feel like your heart is doing somersaults in your chest right after waking, or if you feel a fluttering sensation in your throat or neck, tell your doctor. Do not wait for your next annual physical. Make an appointment. Warning sign number 3. You wake up with chest tightness, pressure, squeezing, or discomfort that goes away after you have been up and moving for a few minutes. Some people describe it as indigestion or heartburn. Others describe it as a heavy weight on their chest. Others feel it in their shoulder, their jaw, or between their shoulder blades. This could be morning angina. It means your coronary arteries are not getting enough blood flow when your heart rate increases after standing. The fact that it goes away after a few minutes does not mean it is harmless. It means your heart is warning you that a blockage is forming or that your arteries are too stiff to dilate properly. Never ignore chest discomfort in the morning, even if it goes away quickly. Warning sign number 4. You wake up with shortness of breath that gets worse when you stand up or walk to the bathroom. You are not just out of shape. You are not just getting older. If you find yourself breathing harder than you should just to walk 20 feet from your bed to your kitchen, your heart is struggling. This could be fluid building up in your lungs overnight because your heart is not pumping efficiently while you lie flat. That is a sign of heart failure. It could also be a sign that your heart valves, especially the mitral valve or aortic valve, are not working properly. Shortness of breath in the morning, especially if you need to sit up or stand up to breathe easier, is a red flag. Do not ignore it. Let me tell you about Dorothy again, but more of her story. Dorothy was 68. She had all 4 warning signs. Every morning she stood up quickly, felt dizzy, held on to her dresser, and told herself she just needed coffee. She had morning palpitations but ignored them. She had chest tightness but called it gas from dinner. She had shortness of breath walking to the bathroom but blamed it on being overweight. One morning she stood up, took 3 steps, and collapsed. Her husband found her on the floor. She was unconscious. He called 911. In the emergency room, we found that she had gone into a dangerous heart rhythm called ventricular tachycardia. She survived because her husband started CPR immediately and the paramedics arrived within 8 minutes, but she needed a pacemaker. She needed months of cardiac rehab. She needed 6 medications. When I asked her why she did not tell anyone about her symptoms, she looked at me with tears in her eyes and said, "I thought it was normal. I thought everyone my age felt that way. It is not normal. It is not normal to be dizzy. It is not normal to have morning palpitations. It is not normal to have chest tightness. It is not normal to be short of breath walking to the bathroom." If any of these 4 warning signs sound like you, please make an appointment with your doctor this week, and in the meantime change how you wake up starting tomorrow. So what should you do instead of jumping out of bed? I am going to give you a safe, simple, life-saving morning routine. It adds about 2 to 3 minutes to your morning. That is it. 2 or 3 minutes that could save your life, prevent a fall, or keep you out of the hospital. Follow these 7 steps exactly, starting tomorrow morning. I want you to practice them tonight before you go to bed. Step 1. When you wake up, do not move immediately. Do not open your eyes and throw off the covers. Lie still for 30 seconds. Just breathe. Feel your breath moving in and out. Let your body realize that you are awake. Let your morning hormones start their natural surge. Give your brain time to tell your heart, "We are waking up now. Get ready." 30 seconds is all it takes. Step 2. Slowly sit up. Do not swing your legs out of bed yet. Just sit upright in bed with your back against the headboard or against a pillow propped against the wall. Stay sitting for 30 seconds. Let your blood pressure adjust. Let your heart rate increase gradually. From its sleeping rate, you might feel a little lightheaded during these 30 seconds. That is fine. That is why you are sitting, not standing. Just sit and breathe. If you feel very dizzy, stay sitting for another 30 seconds. Do not rush. Step 3. After 30 seconds of sitting, slowly swing your legs over the side of the bed. Sit on the edge of the bed for another 30 seconds. Let your feet touch the floor. Let your toes feel the carpet or the wood. Let your body get used to being upright with your legs hanging down. This is the position where most people feel dizzy if they are going to feel dizzy, so take your time. If you feel dizzy, wait longer. Breathe deeply. Do not stand until the dizziness passes. Step 4. Stand up slowly, using your hands on the bed, a nightstand, a walker, or a cane for support. Do not stand up without something to hold on to, even if you think you are steady. Stand in place for 15 to 20 seconds before you take your first step. Make sure you do not feel dizzy. Make sure your vision is clear. Make sure your heart is not racing. Make sure your knees feel stable. Then take your first slow step. Step 5. Before you do anything else, before you go to the bathroom, before you make coffee, before you let the dog out, drink a small glass of room temperature water. Not cold water from the refrigerator, not ice water, not a full 16-ounce glass for 2 6-ounces of room temperature water, that is about half a cup. This water begins to rehydrate you after 6 to 8 hours of sleep. Rehydrated blood is thinner, easier for your heart to pump, and less likely to form clots, room temperature. Water is important because cold water triggers the mammalian dive reflex, which can cause your heart rate to slow and your blood vessels to constrict suddenly. That is the opposite of what you want in the morning. Warm or room temperature water is gentle on your heart. Step 6. Do not do anything strenuous for the first hour after waking. The highest risk hours are 6 a.m. to 10 a.m., so between those hours take it easy. No heavy lifting, no running for the bus, no shoveling snow, no vigorous exercise, no sprinting upstairs. Your heart needs time to fully wake up and adjust. Gentle walking around your home is fine. Stretching is fine. Sitting and reading or watching the news is fine, but save your workout, your gardening, your heavy housework, and your errands for the afternoon or evening when your blood pressure is lower, your blood is thinner, and your heart is more resilient. Step 7. If you take morning medications for blood pressure, heart conditions, or diabetes, take them with food unless your doctor specifically tells you to take them on an empty stomach. A small breakfast, even just half a banana or a piece of toast, helps buffer the medication and prevent sudden drops in blood pressure. And never ever take your first dose of the day while standing up or while rushing. Sit down, take your pills with your small glass of room temperature water, sit for another minute, then go about your day. Let me tell you about Harold. He was 72. He had high blood pressure and mild heart failure. He followed this routine religiously after I taught it to him. He set a timer on his phone to remind himself, wake, wait, sit, wait, stand, wait. Water, wait, then go. One morning his wife woke up with crushing chest pain. Harold stayed completely calm. He did not jump out of bed. He sat up slowly. He helped his wife sit up slowly. He called 911. He stayed on the phone with the dispatcher. He met the paramedics at the door. He was not dizzy. He did not fall. He was able to help his wife because he had trained himself to wake up slowly. Harold told me later, Dr. Grant, the 2 minutes I spend waking up slowly saved my wife's life because I was not dizzy and confused when I needed to help her. This routine does not just protect you, it protects the people who love you. It protects your spouse, your children, your grandchildren. If you fall and break a hip, who takes care of you? If you collapse from a heart attack, who finds you? Take 2 minutes. Sit up slowly, drink water, be patient with your heart. It has been patient with you for 60, 70, 80 years. If you have made it to the end of this video, you now know why 40% of heart attacks happen between 6 a.m. and 10 a.m. You know the dangerous morning habit that takes less than 25 seconds. You know the 4 warning signs that your heart is struggling. You know the story of Eleanor who survived and Dorothy who collapsed. And you know a safe, simple 7-step morning routine that takes just 2 to 3 extra minutes. But knowing is not enough. You have to do it, starting tomorrow morning, not next week, not when you feel ready. Tomorrow, before you open your eyes, I want you to hear my voice in your head saying, lie still, sit up slowly, wait, stand slowly, drink water. Do this every single day until it becomes automatic, until it feels strange to jump out of bed. Now I need you to take 3 more steps right now. First, click the like button. This is not for me. I do not get paid per like. This is for every senior who will see this video in their recommendations tomorrow morning. The more likes this video has, the more YouTube shows it to people who need this warning. 1 click from you could save a stranger's life. Second, subscribe to this channel and turn on the notification bell. I post a new senior health warning every single week. Next week, I am revealing the #1 bedtime habit that destroys seniors' hearts. It is something almost everyone does before they go to sleep. It feels relaxing. It feels harmless. It is not. You do not want to miss that video. Turn on the bell so YouTube tells you the moment it is live. Third, and most important, share this video with your spouse, your siblings, your parents, your adult children, and anyone you know over 60. Send it in a text message right now. Post it on Facebook. Email it to your bridge club, your church group, your senior center, your yoga class. Talk about it at your next family dinner. Print out the 7-step morning routine and tape it to your bathroom mirror, next to your bed, or on your refrigerator. You could be the reason someone sits up slowly instead of jumping out of bed. You could be the reason someone avoids a fall, a broken hip, a brain bleed, or a fatal heart attack. Dorothy survived because her husband found her in time. Eleanor survived because she called 911 immediately. But for every Dorothy and Eleanor, there are hundreds of seniors who collapse alone, who are not found for hours, who never make it to the hospital alive. Do not let that be your family. Do not let that be you. This is Dr. Elliot Grant, cardiac surgeon with 25 years in the operating room, reminding you that the first 25 seconds of your morning should be slow, not fast. Your heart has carried you through decades of life, through births and deaths, through joy and sorrow, through every single morning of your life. Give it 2 minutes to wake up. Lie still, sit up, wait, stand slowly, drink water, take your medications with food, be kind to your heart, stay safe, rise slowly, and I will see you in the next video.